The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. Today I'm joined by who I think is probably the most popular testicular cancer survivor in the entire world right now. Jonny King is joining me. Jonny, thank you so much for being here.
Thank you. No, it's so great to be here. Really grateful for the opportunity.
And I say that because, like, even going back to last April 2024, on our Instagram, we posted a collaborative post with you that got like hundreds of thousands of likes. I just looked at it, 908 comments. Since then, you're doing all kinds of stuff over in the UK. I mean, you said yourself, you're the poster boy for testicular cancer.
Yeah, it's kind of just happened to be that way. I was always going to be vocal about my experience and trying to do what I can to promote a better understanding of testicular cancer. And yeah, everything that's kind of come my way, I just feel so privileged to have had the experience of. So it's all good.
Before we jump into your testicular cancer story, tell me a little bit about who you are.
Oh, okay. So I'm a 26-year-old guy living in the UK, in the south of the UK, a place called Brighton. And I work as a recruiter, so executive headhunter. I've got a background in science. I did my degree in biochemistry, which has probably helped me stay a lot more informed about my experience. Other than that, just living my life as a young adult and, making memories, enjoying being around my friends and my family. And certainly now got a story to tell and, living every day as a new day, really.
Great. Let's go back to what led up to your diagnosis. What was it that you noticed before you went to your doctor?
So this was back in November 2023. I was getting changed. I was with some friends, about to go on a night out actually, getting changed. And whilst doing so, I was just checking myself and found something that I thought wasn't supposed to be there. So it was a hard lump on my right testicle. I did think a couple of weeks prior to that, I had some mild pain in that area where sometimes when the testicle goes kind of inside a little bit, it felt painful and it wouldn't really kind of come out. So upon checking, a few weeks later, a lump had seemed to have formed. So at the time I thought, right, there's nothing I can do about that right this second. So I just put it out of my mind, carried on with my evening, and then once I got back home, realizing that it was still there, made the call to speak to my doctor, and then had I didn't actually see them face to face. I filled out a form. In the UK, sometimes you fill out a form rather than see them face to face, and based on the information that you put in your form, they make a decision about whether they need to see you or whether they just send you straight for a scan, which I had. So I had my ultrasound scan done about a week and a half later, had those results come back. A few days afterwards, they were sent back to my doctor and they said, right, we need to refer you for suspected cancer. So that's where my story started.
Great. So we do have a pretty decent listenership in the UK, but we're predominantly in the US. So can you give a high overview for those who maybe have joined as a listener since our last UK guest of what the healthcare system is like?
Sure. So in the UK, we have what's called the National Health Service, which everyone here kind of calls the NHS. And this is essentially our publicly funded healthcare system. The principle of the NHS really is that it should be free at the point of use, and it's available to everyone based on clinical need rather than their ability to afford it or their ability to pay. And it's one of the largest publicly funded health systems in the world. So it's mostly funded through general tax and national insurance is what we call it. When you get your pay and you get your paycheck, it's kind of before you don't even see this money, it just goes into what's called national insurance. So for most services at the NHS, there's no kind of bill at the end of it. We don't pay premiums. Some small charges can exist, like a prescription. Sometimes you'll pay a subsidized amount of money, but they're heavily subsidized across many different groups. And yeah, in the UK, it's run as kind of separate NHS systems known as trusts. So a few hospitals often fall under a specific trust in a region. So I guess what happens is, so the primary care doctor equivalent in the UK is called a GP, general practitioner. So this is who I contacted when I first found my lump. This then gets referred to a specialist, so a urology consultant. And then after that, you get referred to an oncologist. So all of that is, the referrals can sometimes take a little bit longer than what they might take in the US. However, whenever cancer is concerned, they follow a strict kind of urgent pathway where the target is to be seen within 2 weeks, which was met for me, certainly. I had all of my appointments within 2 weeks, and I had my orchidectomy within a month of finding my lump, which is pretty much on target for the UK. So yeah, the care model is you always see your GP, your primary care doctor first. You see a specialist via a referral from the GP. I think that kind of is a basic summary of the NHS.
Cool. Yeah. Thank you. So you felt your lump, you did all those steps to get to your orchiectomy or orchidectomy. And then I know that you ended up doing chemo and RPLND. So after your orchiectomy/orchidectomy, what was it that kind of indicated further treatment was needed?
So even before I had my orchidectomy, it's called orchidectomy. I don't know why it's called orchidectomy in the UK, but it is. Before I had that done, I had my bloods drawn, and I had a CT of my chest, abdomen, and pelvis. My CT was clear; there was no sign of spread, and I had my bloods taken where I had elevated HCG, elevated AFP, and my LDH was normal, or it was within the normal range, which is kind of what they were expecting. Being 25 at the time, non-seminoma was going to be more likely. So yeah, had those done. They were elevated. They weren't crazy numbers yet. So my HCG was around 280, AFP was around 70. This was 2 weeks before I had my orchidectomy. I then had the orchidectomy, which for me, luckily, was a very painless procedure. I was home within a couple of hours. That was a really straightforward. It was like having a tooth out in comparison to RPLND. And then I had a checkup a week later to check the wound, which was fine. And then I had my bloods done again. At this point, both AFP and HCG had risen further. So not what we would expect once the tumour's been removed. And then by the time I saw my consultant oncologist for the first time, she said to me, right, your scan was clear. However, just after your operation, your tumour markers were higher. We want to measure them again because I didn't have my tumour markers measured at the point of my operation. It was conceivable that they could have been coming down already and they were higher than what they were post-op. So she measured them again, and at this point, my AFP had fallen a little bit. Actually, it was back to about 30, but that wasn't following a normal kind of half-life. However, the HCG had risen all the way up to about 4,600. So at this point, it was quite clear that I still had active tumour marker, active cancer in my body. So she gave me a call and said, you'll need to come back in, sign a consent form for chemo. We'll have to do another CT scan to restage you, which was a shock. It was a real shock to me because I had my pathology back, which, as well as confirming it was a mixed non-seminoma, there was no lymphovascular invasion. It hadn't invaded certain regions of the scrotum either. So everything apart from the bloods pointed towards it being clinically stage 1. So that was probably more of a shock, actually, than to be told that I had cancer in the first place. It was to be told that it had spread. And to this day, that probably remains the biggest shock to me. So that's what led me down the route of being treated for metastatic disease.
And up until this point, what is your support system like? I mean, when you got that news that there was spread, what was your network like? Who was able to rally around you, if at all?
So I've got a really good support network with my family. My friends, were there on hand to support me going through the diagnosis. When I was told that I needed the chemotherapy, which became a very isolating experience, I don't think many people who are in their 20s really get what that's like to have to go to the chemo unit, most days, because that's what the regime is like on BEP chemo. You feel really isolated. You look on your phone and everyone else is, out and about enjoying the life that most 20-something-year-olds are enjoying, and yet you're here stuck on a chair with a tube, delivering, essentially what is very toxic chemicals going through you. Losing your identity, losing your hair, losing your kind of joy and any other kind of enjoyment, leaving the house only to have chemo. This is not how most people are living their life when they're in their 20s. They're trying to form memories that are laying the foundations for the rest of their life. And yet here you are in a chair, just feeling sorry for yourself. So it felt hard to relate to many people my age, and I couldn't connect with them anymore. I felt like they couldn't talk to me because they couldn't relate. This is another reason why I do what I do, to try and spread awareness. And if you have a friend who's got cancer, you need to be there for them and support them. And I'm really thankful for the friends that I've got now who did stick by me. But yeah, you learn a lot of lessons beyond just your own health. You learn a lot about. You get a new perspective on life, I say, and I think I'm grateful to have that perspective now, because not many people at my age have it.
Yeah, I mean, when you're sitting in that chair alone, I remember thinking like I would rather do anything but here. And since then, not that I've done too many crazy things, but I did like a comedy class, and I don't know, I try to do things that I wouldn't have otherwise done. Do you find yourself doing that too?
To some extent, yeah. I could do a lot more, and I want to, and I will. But I'm taking it slightly kind of baby steps, I would say. There's stuff that I'm planning on doing, and I'm not as inhibited as I probably used to be, because I say to myself, right, if I've been through chemo, if I've been through major surgery, then I can do something which I probably thought before was too, but made me too nervous or whatever. Life's too short. So I do some stuff now. I mean, I've got a lot more confidence in me now. I've got no anxieties about going to the gym or doing whatever I want, really, in many ways. It's a work in progress, but yeah, I've got a lot less inhibitions now.
Speaking of the isolation you mentioned, at what point did you meet or talk virtually with another testicular cancer survivor to kind of have somebody to relate to?
Going through my diagnosis, I got in touch with someone who was being treated for a seminoma, and funnily enough, we are under the same consultant at my hospital. So he kind of told me a little bit about what to expect for the orchidectomy, and then I was very vocal when I started to realise the extent of my disease. I posted about it on X, and I had someone contact me who had been through a very similar experience as me. They were, I think, 2 years ahead of me. So they'd already said that they'd had the RPLND op as well. So again, he was a great support for me, helping me understand some of the processes, and knowing that he'd been through it so successfully gave a lot of reassurances to me beyond the statistics that testicular cancer is a curable disease and you're very well looked after. Just to get a real life example is a massive reassurance. So I got in touch with him as well. I've met loads of wonderful people along the way, and everyone's got a different story to tell. Everyone's got a unique perspective on things. And I think I'm so grateful to know all these amazing people that are, just as much of a hero as people say I am. I'm just so grateful to know these people. And I think these voices, I only wish we had a bigger audience sometimes, because, the stories we've got are amazing.
For sure. Let's talk specifically about your BEP or BEP chemo. Anything notable happened during your treatment?
Something I really struggled with. It's not necessarily the drugs themselves. It was the process of having the chemo. So I didn't have a port or a PICC line. I had hand cannulas each time. I attended the chemo unit as an outpatient, so I would come and go every day. And the team that I was on the first week, I'm there Monday, Tuesday, Wednesday, Thursday, Friday, and then the following 2 weeks, I just go on the Monday. But that first week, it was difficult having to cope with, is this cannula going to work? Is it going to break a vein? Because they're not as stable as the PICC line or the port. It's I can remember today this feeling of, they let you keep a cannula in overnight, for example. You go home with it kind of wrapped, and then they flush it the next morning with what felt like a massive force plunging that saline syringe, and you feel it go through, and it's horrible. Those were the real kind of that was less than enjoyable, I would say. To this day, I used to have quite veiny hands, but I don't really anymore. They've kind of gone back in to kind of recover, I think, and it takes quite a long time for some of these veins to recover. So the cannulas were difficult. At the beginning of every session, I would have my blood pressure and my pulse taken. Again, that was anxiety inducing for me. I remember early on in my chemo, I was told my heart rate was high, and this was mostly anxiety. It wasn't necessarily a physical side effect of the chemo, but their remark that my heart rate was high, and it was about 80 beats per minute. It was higher than normal, but it wasn't high in the sense that someone who's actually got, tachycardia. I really struggled with that, and they would say, we're going to check we're going to check it again in a moment. Meanwhile, my pulse is only going to go higher because I'm nervous about it. So it was sometimes everything around the chemo made me nervous, depending on the nurse I had that day as well. We've all got our favourites, I think, when it comes to who we had when we had our chemo. So those two stick in my mind quite a lot. In terms of the side effects from the chemo themselves, I got through it fairly okay, I think. I didn't struggle too much. There'd be days when I would feel very tired and where I wouldn't have a lot of strength in me to walk about or to have some food. But luckily, I was really well looked after. I live at home now still, actually, with my mum and my dad who drove me every day to the hospital, cooked me my dinner and my food, made sure I was looked after. And again, my consultant, does a remarkable job at taking care of me and her other patients. And my bloods were always, all my kind of non-tumor marker bloods, they were always in a normal range for what you'd expect. So I know people can have it a lot worse. I was never hospitalized with neutropenia, and I'm really grateful for that. So I'm conscious that I had one of the better experiences physically, although mentally it still took a massive toll on me.
Yeah. And I know you mentioned in your submission on our website that you had Raynaud's, or it was exacerbated.
Yes, so I've always had strangely oddly looking coloured hands when it's cold, or it tingles when it's an extreme temperature. And I think the trauma, or the physical trauma of having loads of plastic tubes put through both hands has kind of upset that quite a bit. It took ages just for a vein to be found when a tourniquet is put over my hand for a blood test, for example. So in the first winter after my chemo, I had to make a lot of effort to wear gloves or, move my hands a lot so that I still had a sensation of a feeling in them. It's not extreme, but it's something that I noticed. So that's probably one long-term thing I'm taking away from my chemo. However, I have found that since exercising a lot more and weight training, because that increases, surface level blood flow to these areas, that's actually improved it. So it's not perfect, but that's one way I handle it.
Interesting. Okay. And I know, speaking of the heart rate, I know you asked one of the questions that I ended up asking in the cardiologist episode. Was that answer up to your, did that give you a little bit of peace of mind?
Yeah, definitely. I thought, well, that's my question when I heard it on the podcast. I mean, it's great anyway that my heart rate's back to what it was. But I agreed with everything that the guy said there. And I think I said a minute ago, actually, it's not just the heart rate's difficult because it's determined not just by how things are physiologically, but also psychologically as well. So it can be difficult to always ascertain why. If your heart tracing is fine and you've got a high heart rate and you're in a nervous environment, it's probably anxiety.
Yeah. All right. So chemo ended and you did end up having the RPLND, correct? So tell me about, what happened after chemo that indicated the RPLND was still necessary.
Sure. So RPLND isn't done, I think, as routinely as it is in the US. My tumour markers had normalised after my second cycle. So after I had 3 cycles, I had another CT scan to look at the response radiologically. And my lymph nodes weren't big to start with. They were less than 2 centimetres when I had these really high HCG levels. So when I had another CT scan, they hadn't shrunk a lot, but that was because they weren't very big to begin with. And they did, so it had gone from about 1 centimetre to about 7 millimetres. So it wasn't a significant reduction. However, they said that they looked quite cystic or lumpy, as my doctor described it. So that, in conjunction with my original pathology being embryonal carcinoma, yolk sac, and mature teratoma, they said that the only way to really know what's going on there is to take them out. And I was familiar with this already, but it wasn't certain that I would need it. So now it became more of a, right, it's best you have this surgery as it's going to be an investment in your health long term. And it saves you having to have several CT scans over the space of, 1 year, for example. So, what I did is I got referred off to there's a hospital in the UK called the Royal Marsden, which is a cancer specialist hospital, which is seen as a centre of excellence for cancer care, and it's a tertiary centre, so high volume. Like most RPLND operations, if they're done in the UK, they are often done there in London, unless you're high up north, because there'll be other centres up north, but most surgeons that perform them work at the Royal Marsden. So I was referred up there. At first, I was thinking it might be a keyhole operation, until I was then met with my surgeon and said, because you've had chemotherapy, because there'll be scarring and various other things because you've had chemo, it's easier and you get a better field of vision if we just open you up. So that's when I was told it would be an open op as well, which was a shock in the moment, because you read a lot about how surgical innovations have led to things like robotic surgeries and keyhole surgeries and short stays, and yet here we are still doing open operations. And I completely got why it needed to be open, but it was just scary to think I'd be opened up to that extent. Again, who in their 20s has to go through these kinds of major operations before? And owed to my background in kind of biology, I kind of knew exactly how major this is, opening you up, cutting through all those tissues, moving your bowel out the way, working so close to your major blood vessels. It's scary, and there aren't many operations that feel as scary as that. And I said earlier, this is why it feels like the orchidectomy is nothing in comparison, in my experience. So it was a shock to have to go through that for what felt like having a disease that I caught, that I acted on almost immediately, and yet here it is. I'm having to have all these procedures done and the chemo, despite catching it so early. So this again was hard. It feels like, when's it going to end? I was told, after the orchidectomy, you've probably got stage 1. Then I have the chemo, and they say that will probably be it. And now I'm being told I have to have when does it stop? Will I have to have radiotherapy? Will I have to have a lung surgery? It felt like it was never going to end. So I had to gather up all the strength I still had in me after all of that and go through it. And yeah, it was tough, but I did it. And I remember coming out of the operation, I remember waking up and thinking, well, although feeling very sore, but I remember thinking, right, I feel so. There's this kind of belt and braces. They say it's once these are out, everything has been removed. Any other site, there's no other site of disease in you. So having had this out, it should be everything. And I remember feeling the sense of relief that everything where there was a site of something malignant is now not only been killed by chemo, but also been surgically removed. So it's no longer in me. And we had the pathology back a couple of weeks later saying, yeah, it was all mature teratoma. They had removed about 33 lymph nodes and only 3 of them had this in. So it all completely excised. And that brought a lot of relief before going on the kind of journey of being in remission. So yeah, it was the final hurdle was a big one.
Yeah, definitely. To have the pathology come back as the teratoma, I guess definitely makes it worth it when you're going in kind of uncertain. Now, I don't think this is a secret, but you were an out and proud gay man, correct? And was retrograde ejaculation at all a concern for you? I mean, I know banking sperm, I mean, maybe you would want to in the future have like a child through surrogacy or IVF or something. Or was that not at all something that you were worried about?
I remember being told this when I first got my diagnosis, saying we're going to do sperm banking before we do your orchidectomy. And I did go ahead with the sperm banking, mostly because I was young and I want to have longer to think about whether I want to have a child. I'm not in a relationship, so it's more just insurance. I did it because it's paid for by the NHS for several years. So I wanted to just hit pause on having to consider loads of these things. And fortunately, it's not like this is sperm banking is a very simple procedure. It's not like having eggs harvested or if you're a female. So, I wasn't too worried about retrograde ejaculation. I thought, well, if it happens, it happens, and it's the lesser of two evils. I'd rather have ejaculation than have something that could fester in me and become a big concern later on in life. So this, again, I guess comes down to perspective. I didn't spend too long worrying about it. It was a worry, but it wasn't at the forefront of my mind. And I guess I'm lucky as well because I don't have that side effect either. He did do a nerve spare on the left side of the template, so luckily everything's normal. But I appreciate it isn't for everyone. So again, it's weird. It might be weird for some people to hear me say it's a privilege to have got through this surgery, and still not have to worry about those things.
Yeah, and I asked because there was actually a post on Reddit this morning from a 38-year-old gay man who didn't feel like there was enough resources for gay testicular cancer patients and survivors. So, with that guy in mind, what perspective or, what can you share to kind of help him in his early stages? Not knowing his entire background, and I'm just telling you that there's a Reddit post, but I mean, what would you say to him?
So this is a guy who's got retrograde ejaculation.
I think he's like stage 1 or just had his orchiectomy and is not finding enough resources for gay men.
Okay, that's a good question. I've not really come across anything that's specifically tailored to gay men. I don't know really what there could be. I always make an effort to try and think how it could be, but I think most men would put themselves in the same boat, whether they're gay or they're straight. It's difficult. I appreciate there's loads of different perspectives because if you're thinking about attitudes towards sex, you always know when a man climaxes, but you don't necessarily if you're suffering with retrograde ejaculation. So I think having the right care in place that might not always be best given to you by a surgeon or an oncologist. I think having supportive care and a total kind of total package of care, I guess is the word. So speaking to a psychologist, if that's part of the kind of care network, or support nurses. In the UK, we have a good nursing network. Macmillan is a charity in the UK which employs several types of nurse professionals who are well trained to support people holistically. I guess what I'm saying here is you need to see a patient as the whole picture, whereas different specialists only work on different areas of the patient. A surgeon just works on their organs. An oncologist would just work on the cancer. So whereas if you've got a support nurse or a psychologist or psychiatrist even, but whatever the appropriate person is, they're seeing them from the angle that this person needs to be seen in. That's quite a long-winded answer, but I hope that's somehow useful.
Yeah, for sure. In your experience, and we don't have to get too into the weeds unless you want to, but I mean, when you talk about it with other gay men, are they receptive and supportive, or are they like kind of like put off by having one testicle? Or, I mean, is that even a fair question to ask?
It's a fair question to ask. In the gay community, there are a lot of body standard issues, in my opinion, and that can stem from a lot of reasons that kind of goes beyond the scope of this podcast. But I've never had any issues, and the two people that there's several people I know who have had testicular cancer who are gay, and as far as I'm aware, they've not had issues from a sexual perspective, or being seen as someone who's kind of sexually desirable. I've not seen that be a problem for them from what they've told me, and I certainly don't see it as a problem. I don't have a prosthetic, so it's quite obvious if someone was to see me, but I would never give my time to anyone who would be raising their eyebrow over whether I'm kind of valid as a sexual person based on whether I've got one or two testicles in my scrotum. It's just, I'm not wasting my time with someone who wants to have that kind of opinion. And there, in the gay community, I feel like a lot of judgments are passed based on how someone looks. So I've already got a sense of, right, well, I've got no time for someone who's only going to judge someone based on superficial crap like that.
Yeah, no, that's great perspective. And I think that's a great example to set. And others who are kind of, I don't know, more timid, hearing you lead that way, I think is a great thing. So since your RPLND up till now, we're at a little bit over a year, I think, right? So what has the last year been like for you?
It's been a year of healing, I would guess, is the best place to put me in. So I'm just over a year, May, June, July. Yeah, so I'm about 14 months in remission since my RPLND. And at times I've been wanting to wish that time away, because I know the risk falls over time. And when you're kind of 2 years down the line, the risk is significantly less. And yeah, sometimes I felt like I wanted to just wish this time away, but I'm also aware that this is my life. I need to live my life. And there's no point not getting the most out of every day, because life is precious. So I've been battling with that, especially in the first few months when I wanted to kind of bank these months of being clear. I always get my anxiety around my scans and my blood tests. I've got one coming up soon, actually. So, it's on my mind a lot, but I don't know, you never get over it. And it's probably similar to grief in the way that over time you become less sensitive. It's still there and you can still react to it, but it gets less over time, I think. And I'm not living in fear. I'm just very aware of the situation I'm in. And I talk to people. I'm well supported by the people that I kind of trust in. So it's been an interesting year, and I've not let anything stop me. I remember joining the gym about 3 months after my RPLND, and I got back all my strengths and then some, because I lost a lot of weight from the RPLND. And I felt weak. My hair had only just started growing back, and I'd only just started walking, at a normal pace. So being at the gym has been a massive been a massive kind of medicine for me. Sports medicine, I really believe in, or exercise medicine. I think long term, there's been loads of podcast episodes about, you know, the importance of exercise and looking after yourself, because testicular cancer is a disease of survivors. You want to survive and you want to do it well. So I go to the gym, you know, 3 times a week now, maybe. I look after myself. I don't drink alcohol anymore. I just try and live my best healthy life. And I feel when you look good and when you feel good, you do good. So yeah, that's my philosophy now.
Yeah. And as we mentioned in the beginning, you're the quote poster boy of testicular cancer, at least in the UK. So what kind of, what does the awareness thing look like for you moving forward?
I do whatever I can when I can, really. I'm still living, I'm still doing my job, I'm still doing my things with my friends. If there's ever an opportunity to put my hat in the ring and do something, then I do it. In the last year, I've done a similar podcast to this with a Scotland-based charity called Cahonas. I've also done some videos with other cancer specialists who have their own experience to share. I've done a lot with Macmillan, the cancer charity I mentioned earlier. I'm always happy to do something because I've got a story. So I want to share it, and I won't shut up about it, because there's stuff that anyone can learn from these stories. I've only recently done a kind of a photo shoot opportunity with a cancer platform charity, and I'm looking forward to seeing that come out, because that's a brilliant collection of other types of cancer survivors, bringing people together. And I'm always passionate about advocating for the cancer care that needs to be for our age group, for our kind of young adults. I feel like a lot of support might be tailored towards older people, and making sure that there's charities that have 20 to 30-year-olds kind of center stage in their mission is important. So I'm always willing to do the good fights for good causes.
Yeah, for sure. And thank you for doing that. What advice would you share with anybody who is, and I say this podcast is like, people find this after they've been diagnosed. So we're not really reaching people before, but somebody who's just been diagnosed, they find this podcast when they're doing all their Googling. What do you say to them?
I think something that helped me was I kind of split my thinking and my brain into just compartmentalizing. Although it's a shock, because it is, that shock can sometimes be delayed. So live your life as you were, and just be where you need to be when you need to be there. I think of that diagnosis as being on a bit of a conveyor belt, where you get put on by your GP or your primary care doctor, then you've got your scan, then you've got your bloods, and you're just going on that conveyor belt. The conveyor belt is your life, right? So you need to be living your life as that goes forward. And at times there'll be stops where you've got to have a test or maybe a surgery or a consultation. Be there for them, but other than that, live your life, because you will live your life. This is a disease of survivors, and you will get there. You've just got to be at the places that you need to be when you need to be there. Don't stop talking about it either. Don't shut up about it. We know that, and I don't have loads of statistics here, but I know that long-term kind of psychological side effects can happen from going through cancer at our age. So the more you talk about it at this stage, and the more people are listening and positioned to support you, the better. I honestly think the better you'll be. There's a reason I'm so open about it, and I think it's because it's helped me. So talk about it, live your life, and be where you need to be when you need to be there.
Great advice. Is there anything else that you want to add that we didn't talk about already?
I'm sure there's loads, but I'm just grateful really for this platform, and I think it does so much good, and I'm really looking forward to what the future holds for me, for all of my kind of survivors, and bring it on.
Where can people find you if they want to connect?
So I'm on Instagram at _Jonny King. And then I'm also on LinkedIn, but that's more work related. Jonathan King is my government name. I think that's it really. But yeah, follow me on Instagram, and I've always got something fun for my followers.
Cool. All right. Well, I plan to be in London in November unless something changes. So maybe we can meet up. We'll figure that out offline, but it's going to be a whirlwind trip, but maybe we can schedule something. Jonny, thank you so much for being on It Takes Balls.
Thanks, Stephen. Bless you all.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org.